Buspirone is one of the medications which is used to treat anxiety. And the drug is the Escitalopram, which is an SSRI selective serotonin reuptake inhibitor, and this medication can also be used to treat anxiety. Particularly, it can be used to treat generalized anxiety disorder. However, Buspirone and Escitalopram belong to the different clinical categories. Buspirone is well known with its brand name Buspar, whereas Escitalopram is well known with its brand name Lexapro. Actually, Escitalopram is the pure optical isomer of another medication. It is the S enantiomer of citalopram, which is an antidepressant. Even though Buspirone and Escitalopram belong to the different clinical categories, both can be used in the treatment of anxiety, but how they are working in controlling the symptoms of anxiety, whether they can be used as alternatives, otherwise they can be used in combination. All such facts we will discuss in this video. First of all, let us see the clinical use of these medications. Escitalopram is classified as an antidepressant. So it is particularly used to treat the symptoms of depression. However, this Escitalopram can also be used to manage anxiety. Particularly, it can be used in the treatment of generalized anxiety disorder, commonly known as GAD. Not only in this condition, in other anxiety disorders like panic disorder, social anxiety disorder, and phobias, again, Escitalopram can be used. So this medication can be used both as antidepressant as well as anxiolytic. On the other hand, Buspirone is purely anxiolytic. It is particularly used to treat the anxiety disorders like generalized anxiety disorder. However, it is not used to treat depression. So Buspirone is an anxiolytic without any antidepressant activity. Escitalopram can be used for treatment of both anxiety as well as depression. Therefore, it can be used as an alternative for Buspirone in the management of anxiety. So, in the people who are having troublesome side effects with Buspirone, SSRIs like Escitalopram can be given, which are used as alternatives for management of anxiety. But in such situations, when we are going to switch one medication to the other medication, the dose of the medication should be tapered slowly in order to avoid any withdrawal effects. On the other hand, Buspirone is not having any activity on depression, so it is not an alternative for Escitalopram for treating depressive symptoms. Are they combined? Buspirone acts as a partial agonist at 5-HT1A receptors. These 5-HT1A receptors are located at presynaptic neurons and they are autoinhibitory in nature. They inhibit the release of serotonin and its uses. Particularly, Buspirone inhibits this release at raphe-nuclei. It also shows a weak agonist activity at 5-HT2 receptors at postsynaptic neurons. Even this medication can also act by dopamine D2 receptor antagonism. So the main action of Buspirone is on the serotonin receptors. On the other hand, Escitalopram is an SSRI, selective serotonin reuptake inhibitor. It is going to inhibit the reuptake of serotonin. This increases serotonin levels within the brain, which improves the symptoms of depression, as well as they are also responsible for decreasing the symptoms of anxiety. If we see the actions of both Escitalopram and Buspirone, they are completely different. Their common point is the serotonin. So whenever the Escitalopram is given, it can act on the brain to increase the serotonin levels. However, when it is combined with Buspirone, the increase in the serotonin levels may be augmented, resulting in the excessive elevation of serotonin levels. This may result in development of one of the condition, serotonin syndrome. Serotonin syndrome is a fatal condition which is associated with various symptoms like muscle rigidity, tremors, confusion, hallucinations, raised body temperature leading to hyperthermia, and even it can produce tachycardia and palpitations. Many of these symptoms are fatal to the people. Therefore, these symptoms should be closely monitored, particularly when two types of medications are combined that increase the serotonin levels. Because of risk of serotonin syndrome, Buspirone is generally not recommended with Escitalopram. Even combining Buspirone with Escitalopram may reduce few of the side effects. The risk of serotonin syndrome may be elevated. Sexual dysfunction. Escitalopram can produce sexual dysfunction, particularly it can produce abnormal ejaculation and difficulty ejaculation. It can also produce loss of libido, the decreased sexual desire in the people. This is particularly important in many of the people because escitalopram on chronic use can produce sexual dysfunction. Such type of effects are not observed with use of buspirone. So while treating anxiety, the development of sexual dysfunction may limit the use of escitalopram, but buspirone is not having such limitations. Extent of other side effects. Escitalopram can produce various side effects like dizziness, drowsiness, insomnia, and it can also produce some agitation and dry mouth in the people. These are the common side effects of escitalopram. Mainly, it produces drowsiness in the people. On the other hand, buspirone can also have similar side effects. It can also produce dizziness, lightheadedness, restlessness is another important side effect of buspirone. It can also produce some excitement in the people. Similarly, other side effects like fatigue and nervousness can also be observed. However, buspirone is not having the sexual side effects that were observed with escitalopram, and it is also not showing any motor and memory problems that are commonly observed with benzodiazepines. Benzodiazepines can produce the motor disturbances resulting in the muscle relaxation and incoordination, and they can also produce memory loss resulting in the amnesia. Such side effects are not observed with buspirone. Therefore, buspirone can act as an alternative for benzodiazepines who are not able to tolerate such motor and cognitive side effects. Withdrawal effects. Escitalopram should not be stopped suddenly, particularly when this medication is used at higher doses. Sudden stopping of the dose may produce withdrawal effects. This may result in development of few symptoms like irritability, tiredness, and vivid dreams in the people. Such side effects are not observed with buspirone. However, again, buspirone is not recommended to be stopped suddenly. The withdrawal effects are more pronounced with sudden stopping of escitalopram. At this point again, buspirone is having some advantages. Time to show their action. Both buspirone and escitalopram can act on the brain and they can produce delayed pharmacological actions. So they may take around 2 to 4 weeks to show their full beneficial effects, and sometimes they may take more number of weeks in order to show their complete pharmacological actions. Because both of these drugs are going to modulate the functionality of few of the chemicals in the brain, their therapeutic actions are observed after a few weeks of the treatment. Then which is better? Now if we compare buspirone and escitalopram, both are having their own advantages and disadvantages. Buspirone is particularly used to treat the anxiety. It is not suitable for depression. However, escitalopram can be used for treating both anxiety as well as depression. So in the people who are having both depression and anxiety, escitalopram is one of the drug of choice because it can relieve the symptoms of both anxiety as well as depression. And escitalopram can also be used as an alternative for buspirone in the people who are not able to tolerate this medication. However, development of sexual side effects and serotonin syndrome are two important limitations of this medication. Therefore, even escitalopram is more effective in treating the anxiety. These side effects may limit its use. So in the people who are having anxiety as well as depressive symptoms, escitalopram is better. But in the people who develop these side effects, buspirone may be used as an alternative for treating anxiety. However, both of these drugs should not be combined at their regular doses because of risk of serotonin syndrome. So that's all about these medications, buspirone and escitalopram. So that's for today. I hope this video is useful to you. Post your own experience and opinions in the comment section below. Thank you for watching. See you in the next video.